Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
Over 106 doctors have passed away during COVID times. The case fatality rate is 6.1%, which is crude but significant, needs to be adjusted based on reporting. Also remarkable is the fact that the majority of deaths happened under the age of 60. This is a tribute and an opportunity to learn for the rest of the fraternity.
For the first time, an attempt has been made to tabulate just how many doctors and health workers have died in the 3 months of this pandemic. And the numbers are in fact staggering. This report by Dr. Rajeev Jayadevan of Indian Medical Association Kochi reveals some startling facts. First, 106 doctor deaths are reported that are linked clearly to the pandemic. This includes those who have died from the virus, but may also include unexplained or violent even deaths of those doctors who were on COVID duty. The other thing that emerges and is very, very noticeable is the age of doctors who have been hit. Take a look at this figure. The average age of doctors dying is in fact 56 years old. 55% of doctors who died are below the age of 60. 29.6% of COVID doctor deaths are below the age of 50. 21% of doctors who have died were below the age of 40. And the overall fatality rate is 6.1% for doctors compared to the national average of 2.4%. That's more than twice the number. So we now know that at least 106 doctors have died from the coronavirus pandemic. This is the compilation we have as of now, and those numbers could rise. We are in one housing society in the national capital where one such death took place. In fact, a doctor and his wife, both quite young, 50 and 45, died from the virus. Here we have their two sons, Shobhan and Rohan, 23 and 17, that young. So that's really the kind of human cost that we're talking about when we talk about fatalities of doctors and of course any fatalities. So tell us a little bit about yourself. Are you still studying?
No, I was actually planning for my master's. Yeah, so the entrance exams and everything were pushed ahead because of the lockdown and everything. I've completed my bachelor's, but I'm not working currently.
And you're 23
23,
years old.
yeah.
And you're how old?
17.
So are you still in school?
Yes, 12th.
So this must be like a really, really big, colossal heartbreak for you, right? Your doctor, your father was a general physician, your mother was a school teacher. Tell us a little bit about what happened, because we hear about ordinary patients having to run from hospital to hospital. The same happened with you all.
Yeah, actually, my mom, she returned, this was the third day on 18th, this duty in MCD school for distributing ration. And that same evening, she fell sick. It was the initial symptoms were more like a stomach infection.
Yeah.
And the things kept worsening for her. And then on 22 of April, we admitted her in Panth, GB Panth. There she was until 1 of May. And during the entire time, her situation kept going to and fro between worsening and getting better. But during 1 and a day before, there was some improvement. So when the discharged her, we thought, okay, she'll
be
better.
okay.
Yeah.
Then
she'll
what
be
happened?
Okay. But they said to bring her to
LNJP.
no
RML.
RML, but they said you can take her after a day or two. But the same night, she again started having the same problems. And we took her to RML on 2nd of May. There she was admitted, and there she was until 4th. And the same night, on 2nd, my dad was here and we were leaving. He was fine until that moment. There was nothing. He even shut the door behind us. He was talking on phone. But around 1 in the morning of 3, I came back home and he was semi-conscious. Actually, in fact, he stopped returning my calls after 12 o'clock in the morning.
And you were with your mom?
Yeah, we both were with our mom.
What was your experience at the hospital? At RML? You were trying to get ICU intervention and you couldn't.
It's quite crazy right now because no one is actually, first of all, the initial 1 to 3 hours which are the most crucial in any treatment, are wasted because they don't know. Doctors are not sure whether this is a COVID patient or not, and a lot of the time has been wasted for the X-ray, and I don't know how to complain about it because it's also necessary.
Yeah. But we've seen horror stories of families really literally running from pillar to post, and basically you're saying this happens even to doctors' families.
Yeah,
right?
yeah.
Now you're really young. How are both of you managing? Do you have any other family looking after you?
No, not, close to us. They're obviously relatives to us, but
But you're living alone, both of you?
yes. For
So these are two boys. They're boys, right? 23 and 17, just living all alone.
Yeah.
So how? I know the government did give some compensation because your mom was a school teacher, so maybe financially you're okay for now, but emotionally, like, what are you?
I think that is the biggest part, and no one has ever talked to me about this because everyone kept asking me, what will you do about the financial aspect and about the cooking and stuff, all these stuff, like the duties they used to do as parents. And it became a little frustrating after a while answering these questions because even till now, I would say that the loss is is the biggest thing, not the.
Of
things
course,
they
it's
used
not
to
about
do.
survival.
Yeah,
It's
yeah.
about losing your parents, right?
Yeah.
So tell us their ages. Your father was elder. They both had comorbidities also. One had a brain tumor, the other had diabetes. So tell us about your father.
No, my father had not exactly brain tumor, but hypopatriotism. I don't know exactly what it is, but something to do with his hormones. It started in 2016 or something, but right now he was better. But later on, we can see right now, like actually. Every day new results are new symptoms and new things are being found.
Right.
Like recently I read somewhere that it has neurological effects as well, the coronavirus.
So Dr. Ripin Malik and his wife Bekali are just two of those 106, that number we know now, 106 doctors alone among those who have died from the coronavirus pandemic in the last 3 months. And the people they leave behind are real flesh and blood people. It's easy to think of this as statistics, but really we're talking about two young boys here. Let me ask you, what is the toughest for you right now?
everything day-to-day life, I'm a kid. I'm dependent on my mom. Everything I have to do or want to get done, it's through my mom. Today I had to wear the school t-shirt to attend the online class. I had no idea, I forgot. Usually I would just say to my mom, she would take it out, press it, and she would give it to me.
Yeah.
But just to, in a really hurry, I had to go and search it. I had no idea what it was. I found it, I wore it, and these little things, these common things that are just, it impacts you on a very emotional level that you think just no one's ever going to do that for you. You have to do it.
How are you coping? How are you keeping yourself strong?
I don't know, it's just have to. He's obviously there, so I don't know. It's just have to. I don't know. It's just difficult. I wasn't able to sleep at night. Just having that memory in the of the hospital and all of that. It's difficult. You just have to do it, but it's very difficult.
And you're also boys, so you'll be discouraged from showing your emotion, which you should, of course, do. At 23, you're going to have to become a parent to your younger brother.
Yes. And the same thing, like he said, the biggest problem, that the most consistent one for me is like whenever I turn off the lights at the night,
Yeah.
all those images, they just flood my eyes, and it really it's and then I have trouble sleeping. Like even now, it's been more than a month I have trouble sleeping because, to be honest, it's not what happened, but the way it happened. It's just the.
What was the most harrowing memory from the hospital for you? Or from the entire medical experience?
Okay.
One would think a doctor's family goes into a hospital, they cope a little better.
This is something that I wouldn't believe, like things like this was happened, something which would happen to us, because we lived a very how do I put this, a very enclosed, sheltered life. Yeah. It was in RML on 4th.
Yeah.
My mother became unconscious, and there was no ventilator, and they had the procedure where they put pipes in her lungs through her nostrils and through her mouth.
It's called intubation.
Yeah. And I was given that pump, that transparent pump.
You were given the pump.
Yeah, and I had to
They just pumped it for like 2 minutes and just gave him the pump.
and I had to pump
And
it
I was
for 1 hour.
1 minute. You, as a 20-something boy, was asked to pump the
Yeah.
oxygen for your mother?
Yeah.
You were not even supposed to be there. Why were you there if it was COVID?
Actually, they didn't know until that moment because I did tell them once, and everyone in the ward was like, she must be a COVID patient because the biggest problem she was having, biggest complaint she had was she couldn't breathe.
Yeah.
Still, there was no test done until she was alive, and she was there for 3 days.
And you were, as a young boy, and you were there also?
I was with her the whole time.
And you watched your brother pump her for oxygen?
No, they kept sending me to give this blood test to this, and the blood test was so far. It took 10 minutes to go to the building of the blood test. I just kept going there, coming back, going there, coming back, and the whole time in the lift, I just thought. Everything just becomes all right because when I was going out, I heard the main doctor, whoever it was, that she's just going to survive for 3 to 4 more hours, and if they get the ventilator somehow, it's going to be 8 to 10 hours. And I just completely broken up about it. I didn't even tell him because I knew what he was going through, because he didn't tell me my dad died. He told me the day after when my mother was unconscious. So it was just.
So your father had died when you were having to pump for your mother?
No,
The
my
other way
father
around.
died on 10
On
o'clock on 3rd.
Why did the doctors make you do this? Did they explain to you why you had to do this?
No, I don't know what it was. Actually, I had talked to the doctor about the ventilator earlier in the morning. It was 6 or 7 o'clock when he came first, when he arrived, the doctor who was in charge of the ward. And we discussed this, and I told him, please bring a ventilator. He's taking care of that, whatever that can be done. It was around 4 or 3. It was around 3 or 4. He asked me to get a file to the nephrology department. I went there. When I came back 10 minutes later, my mother was unconscious. They were putting all the tubes inside her.
No, it was.
And he was.
It was one. It was
No,
one.
okay, koi baat
Okay.
nahi, whatever time
Okay,
it
it was
was.
1. Okay. And then
But
I
you
came-
stood there and you physically were asked to pump the oxygen as your mother was being
Yeah.
intubated. And,
And
they
actually,
gave you no explanation for why
I
you
would
had to do
call them because sometimes the way I pumped it, the cycle would not sync in with her cycle of inhalation and exhalation, so it will stiffen up. And I was I would panic and I would call them. No one would come. Other patients would go and call them. They will come. They'll say everything is fine. They'll go back.
And I wasn't there. If I was there, he would have told him and I would have gone there. But they just kept sending me to get the blood test through the building.
And imagine as a doctor's child, you had to go through this. Right?
Yeah.
Yeah. So these are really the ultimate cruel, horrible ironies. This report that has been compiled and tells us that 106 doctors died. We should actually be going to the families of each one of them to see what they've gone through. And as we listen to these 2 young boys, and at my age I can call them boys, 2 young men, 17 and 23, one of whom in the middle of his trauma had to sit there and intubate his mother and physically pump the oxygen to her, and nobody knows why. The other staggering thing that does come out of this report and stays with you is the average age of the doctors who have died. World over, you are told that those above 60 are the ones who are vulnerable. But when you look at the age of these 2 young men who have been boys who would be men who have been left behind to cope in a life with no parents, you also have to look at this data to see something frightening that's emerging in India. Not just is the mortality rate of doctors more than twice as high as that of the national average, but the age of doctors dying is extremely young when you look at the global average of the age groups that are meant to be vulnerable.